Good afternoon, everyone, and welcome to Business as Usual with the Tech Council. I'm joined here today with Jonathan Kirsting. He's Vice President of Visibility and all things media for the Tech Council. And I'm Audrey Russo, President and CEO of the Tech Council. So just a few things to set the stage, and then we're going to jump in because we have a great guest and a set of guests, so we're excited about that. First, I want to give a shout out to Huntington Bank, all the work that they have done for us just over the last few years, but in particular with Business as Usual. If you don't know anything about them, they're the largest SBA lender in Southwestern Pennsylvania and heavily involved in all things small business. Also want to give appreciation to AT&T for their sponsorship and continued support of the work that we do, as well as everything that they're doing for their customers and their communities in response to COVID-19. So a few things about this week coming up. Tomorrow, it's hard to believe, it's Wednesday, the 20th of May, and we are going to have an overview about charter schools, public charter schools and the coalition. We're going to discuss about Pennsylvania cyber schools, supporting them during this pandemic and all related issues there. Thursday, a dear friend and entrepreneur, Meredith Meyer-Grelly, she is the co-founder of Wiggle Whiskey. And they are helping put Pittsburgh on the map, and they're doing a lot of things to respond and adapt during COVID. And then Friday, even though it is Memorial Day weekend, we're packing it, and we have another dear friend of Pittsburgh and the Pittsburgh Tech Council and the community is Mike Moe, founder and CEO of Global Silicon Valley. And you might remember our mutual dear friend, Bill Campbell. That's how we all got connected, and he is an icon in the Valley and around the world. So next week, we also have the global CIO of Zoom and the chairman and CEO of Essential, which recently acquired People's Gas. And then just a few minutes ago, it was confirmed that Travis Williams from the Pittsburgh Pirates will also be joining us. So we are continuing to have conversations and introduce and connect people around all things that matter in our region, as well as in our day-to-day lives, as we experience the surreal opportunities and barriers that affect all of us in terms of COVID-19. So I've muted the microphones. Just want you to know the microphones are muted, but that doesn't mean that you can't participate in the chat. You will, and you can access that. All I ask is just don't put sales material in the chat, but you'll have an opportunity to ask questions. So with that, I would like to bring on today's lead guest, and this is Dr. Karen Feinstein. She's also joined by two of her team members, Mara Leff and Nancy Zients. But I want to start quickly with Karen, and let's start with, first of all, welcome. Thanks for taking the time with us, but also let's jump in and start with the mission of the Jewish Healthcare Foundation, also known as JHF. Why was it founded? You know, you have three primary areas of focus, et cetera. So could you set the stage for us about that? And thank you for joining.
I'm delighted to be here. Thank you for these regular noontime conversations to which we all look forward. The foundation came from the sale of Montefiore Hospital to Presbyterian, and the assets were converted into a grant-making organization. We have three operating arms: Pittsburgh Regional Health Initiative, Health Careers Futures, and the Women's Health Activist Movement. So we are a little more than a grant-making organization. How did we get started? I think, frankly, two things. One, faith-based organizations who owned almost all the hospitals at the time. It was just too expensive for the faith communities to keep operating these complex, extremely expensive organizations. But also here in Pittsburgh, I think Dr. Tom Detry, who is CEO of Presby, looked out his window and saw all these rivals and said, I'm going to own them. So as you know, it came to pass. So I think that's our beginning. Our mission is to improve the health and welfare of people in Southwest PA. But I will say we do a lot of work statewide. We do a lot of work nationally, and now our women's health activist work, we have a global board. So kind of we're local and regional, and we're not. We have 46 staff. So what we've done a lot during COVID is loan our staff to make this pandemic less harmful, as well as set up an emergency fund. But I think, frankly, just having our staff get active has had more impact. And just the last thing I do want to mention is we've had a 30-year war against viruses. Our first initiatives addressed HIV and the measles epidemic that had broken out in Pennsylvania when we started. We've moved on to every manner of hospital-acquired infection, bloodstream, MRSA, et cetera. Then we moved to HPV, and here we are now with COVID-19.
That's great. So you've been having a lot of fun, and not that you've been making sure that all the issues are raised both regionally and around the world. So I really want people to understand that while it's based in Pittsburgh, you've been traveling the world for a long time, trying to make sure that all things connected to your mission matter. And that's the thing that I really want our community to understand, that even though we're all based in Pittsburgh, that's fine, but creating those interdependencies and research opportunities that you've done and invested in is very noteworthy. So we're going to, obviously we don't have enough time to dive into all the incredible things that you've done and led over this period of time, but we wanted to use this time to, talk about the importance of seniors. People who have listened in on our call and have known us know that we're pretty passionate about what has happened to the vulnerable population in our region and how impacted they've really been in terms of, services, community, communal living, long-term care, et cetera. So keeping seniors safe, well, aging in place and connected to the larger community in this current, pandemic, look at the amount of communal outbreaks that we've had. You have been vocal in raising the awareness of the issues. Can you talk about that, and have we course corrected in Pennsylvania and even in the United States?
We have a lot to say about it, and as you've noted, Audrey, we've been saying a lot. Let me emphasize that we come at any issue we focus on. We've been focusing on seniors and women's health since the day we started, among other issues, but we do a mix of 4 things. So we do a lot of our own research. We also commission it. We do a lot of program demonstrations. We also do a lot of training and coaching, and the person you're going to hear from next coordinates a whole team of coaches who work in senior serving congregate living facilities. So you'll know why we're so passionate. And we not only give out grants, which is somewhat complicated, we bring in a lot of grants. So we get a lot of public money to do what we do, hopefully with even greater impact. So we actually bring in more money than we give out. But for all of our aging initiatives, the person who oversees this is Nancy Zions, with whom I've worked practically since the day we started, and who is our chief program officer, but definitely our chief aging officer.
That's awesome. So let's bring Nancy to the screen. Thank you, Nancy, for being here. And we're going to unmute you right now. Okay. Thank you, Nancy. And Brian is going to unmute you. Yes, there you go.
I'm unmuted. Thank you. So to your question, have we course corrected in Pennsylvania? I wish I could say yes, but I can't yet. I look to the day when I can say yes, we've course corrected relative to COVID-19 for seniors. But the stats, as you have been quoting over the past few weeks, are frightening and shameful. We know this is an opportunistic virus, so it's going to go where it can be successful. And it has figured out that it can be successful by attacking seniors. So the stats are that 31% of the cases are in people over the age of 65, but 85% of the deaths are in people over the age of 65. That's just a huge number. It's over 3,000 deaths in Pennsylvania. So we and others know what's needed, and it may not be popular to say it, but I don't think our state and other states are doing everything that they can. Some trial and error along the way, certainly some mistakes along the way, We're partnering with the Department of Human Services at our state level in collaboration with the academic health centers. We're trying to bring education preparedness to long-term care and skilled nursing facilities, but the state itself overall, through the Department of Health and others, didn't do what was needed in a timely fashion, and we've seen the results. So we didn't do what was necessary to protect vulnerable seniors and particularly the workforce that takes care of them. The virus didn't come from nursing homes. I'll say that again. It didn't come from nursing homes and long-term care. It came into nursing homes and long-term care from the outside, from our communities. So we know the necessary steps, testing to make sure that every person that is infected, we can keep from infecting others before we move them into a population that is vulnerable. So if we're going to test people in hospital settings or we're going to test workers, we need to know those results before we mix the infected with the uninfected population. We know we need PPE. You hear that every day on these calls. We need that to protect the spread. We need contact tracing, timely and accurate contact tracing to protect the spread. And we need rapid response teams. We need hospitals or the National Guard to share their talent in infection control, clinical management, PPE, and even staffing if there are shortages in various facilities. So no, we don't think we've done all that we can do and should be done. This is over in acute care in this region. We were lucky it didn't have a big surge, but the Robin Cook type nightmare has a long tail in long-term care. And we have an obligation to turn our sights on pre-hospital care and post-acute care if we're going to prevent more death in our region and across the state. I could talk for days, but I'll stop.
Well, so Nancy, appreciate that. So now that we're at essentially the long tail in terms of reporting, and we've moved into the yellow zone, as per, the orders of the Department of Health and the governor. What are some of the issues that, I'm afraid that we're going to be a little lax right now. Am I just being too paranoid or cautious or uninformed? She can't hear. She's on mute.
Okay, so I'm still muted.
No, you're good.
You're good.
The fact that we are going to yellow on the outside means nothing in the long-term care world. The long-term care world remains red, and it has to remain red. And we have to be careful about the fact that the workers go home every night into communities where people are starting to move around. And we don't practice social distancing and wear masks and wash our hands. Those same workers are going to be at risk. They're going to get infected, and they're going to bring that back into long-term care. The obligation becomes all of ours now to be part of this army that can protect seniors.
Okay, there's one question, Jonathan, you want to ask Nancy, and then I'm going to go back to Karen.
Absolutely. So this is a really, really good question here, and thank you for taking the time to be with us today. This is such an important topic. So the majority of deaths have been in long-term care facilities. Is this because the facilities have shifted from caring for people to making money for corporations by cutting costs wherever possible?
So,
tough one.
No, it's not a tough one because the virus has not discriminated. The virus has been in some of the best homes. The virus has been in those homes that we know should have been on watch lists. And we know should have been attention paid in advance. But I have been saying that it doesn't matter what happened before. We have some excellent homes where the virus came in from the community. What they did about it, it defines a good home from a home that really needs help from the outside. So some of them had the resources, and some of them were the best nonprofit faith-based facilities around the world and around this country and around the state. They had resources that they put to bear. They had a mission, but it didn't discriminate getting in the door. It's what happened after that is all of our responsibilities.
Okay, that's great. So let's Karen, we're going to go back, and then you're going to give an opportunity. We're going to talk a little bit about tech. So you've included in your work the importance of seniors, right? Keeping them safe, but you've also been talking about the digital divide. And the digital divide in schools as they were shut down during the pandemic, but JHF spearheaded the investment in the digital divide, also, I like to call the generational divide amongst seniors. Can you talk about your programs? There's a couple of things that you've done that I think a lot of people would like to hear about and see if they could get connected with.
Well,
So Karen, do you want to start that, or you want to pass it on to Mara?
Well, I'm just going to say that particularly since so many people here have an interest in technology and are well aware that Wikipedia took off right after 9/11 because they had the right thing at the right time. And sometimes that happens. So we had a little known project called the Virtual Senior Academy, and it was doing nicely. It was a finalist for the Up Prize, thanks to Mara Leff, our Chief Innovation Officer. But she'll tell you sometimes you just fate and timing intervene. And so here we had the Virtual Senior Academy poised for action that was very much needed during COVID-19. So Mara Leff's our Chief Innovation Officer, and she'll tell you a little bit about, which we're very happy that we had VSA to lend to the community at this point in time.
Okay, so we're going to unmute Mara and bring her to the forefront. Okay, Mara, do we have you live? It looks like we don't. So I don't. Are you there? Yeah, I can hear you now.
Okay, thank you so much. So the Virtual Senior Academy it's a wonderful program that we started about 4 to 5 years ago based on a successful model out of New York City. And the core of the program is aimed at reducing isolation and loneliness among older adults. And we spent the last several years developing the program, watering it, watching it grow. And can you hear me okay? Yeah,
good.
okay.
All good.
And watching it grow in our communities and engaging partners across the region to provide content for older adults who are at home, who are at senior centers, who are looking for opportunities for connection, for engagement, for lifelong learning, and just to build their social networks. Well, when COVID started to ramp up in our communities, what we found is a program like this was needed more than ever. Locations where older adults could go to interact and engage in person were closed. Everything from, the JCC to our senior centers to various recreation places to play games or just to have conversations. And so we were amazed and delighted that so many organizations reached out to us that were aware of our program and asked if they could start to provide programming over the platform. And the platform, it's very easy to use. It's based on Zoom, which now is, a household name, but it allows for live, real-time interaction. The number one question I get asked is, are your programs recorded? And the answer is no. And sometimes I get sort of a funny look, but it's very intentional, because if it's recorded, it's no different than television. We're looking for the engagement. We're looking for that interaction between people. We don't want passive watching. And so we're really excited about where the program has gone in the past few weeks. We've started a whole new track of intergenerational programming. So parents signing up their kids, they're work from home. Could they put their kid on a Virtual Senior Academy class to give them 45 minutes to work? And they could have wonderful moment to take a class on astronomy or pierogi making or whatever it may be. So it's been a wonderful time for us to watch a program that we had really turn into something special.
So give us an example of the kinds of programs. You just leaked out a few.
Yeah, definitely.
Sure. So anything from, there's some classes that are a little bit more serious in nature. So literature classes or book clubs or movie reviews, but there's also things very lighthearted about, someone discussing a recent trip to Italy and showing photos and talking about the history. Cooking classes, gardening demos have become very popular now with the weather changing. The Science Center, local organizations can do chair yoga and light exercising classes for folks where they're watching. So the JCC, who's a major partner and who will be eventually taking ownership of the Virtual Senior Academy, which is very exciting. working with them to transition the program over the next several months. They've been offering their silver sneakers classes over it, but also doing things a little bit more lighthearted, like doing a coffee connect in the morning in partnership with Age Friendly Greater Pittsburgh. So providing just an hour for people to drop in and chat, to try to create some of those moments in line at the pharmacy or in line at the coffee tree, or where we used to have nice interactions with our neighbors, trying to create virtual moments for connection.
And so are there ways that people can volunteer to help?
Absolutely. Number one, we would love for people to teach classes for us. All of our teachers are volunteers. 45-minute class on anything of your choosing. We would love to have you. It can be, in line with your professional endeavors, or it can be something related to your personal endeavors. We're very open. People love a variety of classes on different topics. And also, if you have an older adult in your life that you think that this program could benefit, they do not have to be currently residing in Pittsburgh. We have a lot of snowbirds that are down in Florida that have relatives who have heard about the program. We're happy to get them signed up. We're doing as much online tech support via the phone as we can. We had a program called a Tech Buddy program where we would train folks, younger people, to go into homes and get them and whatnot. We can't do that right now, so we're doing tech support via the phone. Also, if you have older adults that need technology, that don't have access to computers or iPads or Wi-Fi, they can get in touch with us, and we have partners in the community that can help them get connected with low cost computers. I know you've worked with Computer Reach on your program for the kids. They help us on the senior end as well, getting computers in the hands of seniors.
Oh, that's great. That's really great. So that aligns. So there's a bunch of statements and questions that I'd like to read and get to, and then I want to pass the baton back to Karen Feinstein. But I applaud you. It's timing is everything, and this is very exciting that you're leveraging this and leading the programmatic thinking on that. I know that there are people who would be very interested in participating in this. So Jonathan, can you go through some of the statements and questions so we can make sure that our audience hears them, and then there's opportunities for people to talk?
Yeah, some of the comments I can't always scroll up to because Zoom's locking up on me, but the first one I can see here is from Lisa Palmieri, talking about the fact, she basically says her husband has early onset dementia and is in a facility here in Pittsburgh. Luckily his facility does not have any cases. However, when you have dementia or Alzheimer's, you cannot maintain hygiene as they touch their face and do not wash hands as much. And it's impossible to quarantine them, thankfully, and they cannot be restrained. So, I mean, this just goes to show you how this just impacts everything that's rolling through facilities of all types and kinds, as far as that is. We also have some comments here about more things to be done to battle this isolation. I'm so impressed to see everything you guys have done to keep people connected. What else can we do? Because it seems like isolation can be just as much of a problem, as battling the virus itself too.
So if I can add a little bit about isolation. So some of the best homes are getting very creative, whether it's personal care homes or skilled nursing facilities. They're developing ways to use technology, which isn't capital T technology, it's phone technology, to engage people from everything from doctor's visits, which are both medical and social for a lot of people, to visits with family, to calling from room to room if they are isolated in their own rooms. So if there were 3 or 4 ladies that used to eat lunch together at a particular table, and now that socialization's been taken away, they're helping them with some conference calls so they can still talk to each other in the middle of the afternoon and still joke around and gossip like they used to before. So it's falling a lot on the staff, but the staff is rising to the occasion. And as to the comment about Alzheimer's and dementia and infection control, there are a number of really good programs that we've introduced to staffs in the area about helping persons with dementia to wash their own hands, making games of them, using songs. Music is a great way to get people to do infection control if they have dementia. So it's a question of identifying the problem and then getting some creative staff to come up with solutions. They actually care so much about these residents that they're looking for solutions to keep them safe.
Yeah. We have a great comment here from Amanda Yarger, who's a regular on this webcast. And she's basically saying, so are you saying that people of any age can join up on this? And she was thinking it'd be a nice way to befriend seniors And as a child, she remembers with her parents often visiting relatives in homes and other patients, and basically saying this is a great way to brighten their day and your own day too, if you can volunteer and get out and try to connect with some of these folks.
Yes, unlock. Okay.
So something that we added during this is we do track demographic data for folks that create free accounts. It is a free program. The foundation has supported it so that it can remain that way, so that that barrier is reduced. So we have added a drop down where it says not yet 50, which was our cutoff of a senior based on AARP. It says not yet 50, but looking to meet people of other ages, as a way for you to sign up if you are not technically a senior, but looking for intergenerational interactions. And we welcome that. And it's been really fun and great. We've had people join with their grandparents or just people that used to interact with older adults in these settings. Maybe they used to teach classes in person, or maybe they were just a barista at a coffee shop that used to have regulars that they saw every day that they're missing. They can join. We've had that happen. So we really encourage it, not just to teach for us, but also just to join and interact and meet.
This, and for we putting some of the, and put some links out when we go and post the archive. So let's thank you, Mara. So let's go back to Karen. Karen, as we wrap up this show, and you can see the amount of interest and interaction that we've had, what else can we do? What can the tech community do to help further your agendas?
Well, I'm going to go to the biggest picture of all. We'd love to have any of you do a program. It's so rewarding on the Virtual Senior Academy. Honestly, I took everybody on a trip to Spain with my family, and you'll laugh, but it was one of the most rewarding things I've done. And these are people who will get to travel and will get to mountain bike or do the things you do. So you can talk to them. It's just great. We'd love to have you do it, as Mara said. Right now, I am focused on a bigger solution. We were totally unprepared for this. In one of the wealthiest nations in the world, with the most expensive healthcare system in the world, we have so bungled the distribution of supply and expertise. There's no way to describe it. And that is one reason why our nursing homes are killing fields. We had every reason to anticipate they would be. There's no surprise. So I'm working on a national patient safety authority like the FAA. We should be so lucky. Or even the EPA or the SEC. We have a number of industries that are regulated. I'm sorry, but we need a powerful national force to protect us as patients and to protect our workers in healthcare. They are every bit as vulnerable as you can see right now. So the proof that we don't have what we need is COVID-19. And so we ask all of you, we're doing a national effort. We've got people active around the country. I think it's time for a national patient safety authority. So if you have any interest in that, let me know. And meanwhile, also, please don't accept, if anyone tells you that our state is doing everything they can for the senior housing facilities, please don't accept that. We are not. And you can look at West Virginia and New York and Maryland. They're doing more than we are. They're on our border. So I think the worst thing is to get complacent and say, gee, this is just a problem that can't be stopped. It's a problem that can be helped. And we have plenty of solutions. We'll be happy to contact Nancy or me. But I do want to tell everyone that thank you all as well for what you're doing. Unfortunately, without a national center to coordinate all this, we're all just scrambling and doing our best.
There's one last comment. It's just a comment from a woman, Christina Cash, saying that it's an incredibly scary time to be a Black person with comorbidity, even as a working professional. So that's just a statement, and that's probably true in terms of the data that has been revealed. Everything as it ties to COVID is something that we're just unleashing, and our vulnerable populations are all. We appreciate the focus on seniors, and we see that, but the vulnerable populations are many of us who have any kind of underlying, even non-manifested kinds of, I want to say diseases or situations that actually get flared up because of COVID.
Well, and we know that many of our workers in congregate living facilities for seniors are people of color, and they are being disproportionately affected and having disproportionately bad outcomes. So it is a serious issue, and I would like to encourage, I think this is a time for activism. You know, we will get what we ask for. So I encourage everyone here in whatever medium they like to use and whatever voice, and if they have networks or organizations they're part of, we just can't be silent while people are dying.
Well, the other thing that Christina is saying is it would be wonderful from her perspective if everyone would be mandated to wear masks. So that's just a statement that she's making.
There was a program last night. I watched so many of these things, and they had on a national expert. If only 60% of the population would wear masks, we could conquer COVID. If just 60% would wear masks. And I was knocked over, and this wasn't just someone speculating. This was a national expert.
Listen, we know we could talk for a long time, and you can hear from this conversation, Karen, as well as Mara and Nancy, that people care. And it's a time for activism, and as to take Karen's advice is that don't listen to people saying that they're doing all that they can do, because it takes all of our voices to try to join forces to bring this issue to, I want to say, resolution. And I know that's being a little bit naive, but I think that in many ways we get complacent. And Karen, you have seen so much over the times that you've built JHF. So I'm encouraging everyone. She put her email out there. You heard from Nancy, you heard from Mara. This is just a tiny slice of the world that they have been heralding over several decades. And we just applaud your work, and we don't want to sit back passively. Thank you for joining us and having these kinds of conversations with people who don't get a chance to understand the work that you've been doing. So on that note, I'd like to thank Huntington Bank, AT&T. Thank you, Dr. Karen Feinstein. Thank you, Nancy Zients. Thank you, Mara Leff and Jonathan Kirsting. And we will be back here tomorrow, same time. Have a great rest of the day.